Effects of Asthma on Aerobic and Anaerobic Exercise Performance by Harley Vaughn. Introduction. Asthma is a respiratory condition in which a person's airways become inflamed, narrow, and swell, causing extra mucus and becomes difficult to breathe. A myth that many people get wrong is that you shouldn't do any exercise when you have asthma. This statement is incorrect in several ways, but mainly because exercising is good for anyone. Exercise-induced asthma or bronchoconstriction is when the airways close and cause shortness of breath, wheezing, and coughing during exercise performance. Many of times these conditions worsen if the climate is extremely cold or extremely hot and dry. It is healthy for people who have asthma to exercise because the more active an individual is, the better their lungs will adapt to the breathing intensity. Most of the time, people suffer from asthma attacks while exercising due to their airways drying up. Conditioning is one way to help with that. Doing activities such as walking, running, or even riding a bike can reduce the risk of having an asthma attack. Although people with asthma should talk to their primary physicians to get the correct medication. There are two different types of exercise performances that I did my research on. That is aerobic and anaerobic exercise. Aerobic, meaning with oxygen, is a physical exercise from low to high intensities, including running, walking, cardio machines, swimming, and boxing. Anaerobic exercise, meaning without oxygen, is short duration but high intensity exercises such as sprinting and jumping. Both exercises do play a role in the effects that they have when it comes to athletes or individuals with asthma in their performance levels. Here are a few other types of exercises that are aerobic and anaerobic. Aerobic is brisk walking, dancing, jogging, bicycling, skating, swimming, treadmill, bike, elliptical machines, roller skating, rowing, and racket sports. While anaerobic would be bowling, racquetball, tennis, sprinting, hiking, weightlifting, curl-ups, push-ups, sit-ups, and arm circles. There are several more different types of exercises, but these are just a few. Here are some pictures of aerobic sports. And these are just anaerobic sports and pictures of them. The symptoms of asthma that you should look for is coughing, wheezing, shortness of breath, and mucus buildup. It is very important for an individual with asthma to seek a primary physician to get the proper medication so they can perform at their best ability. The medications for asthma would be a quick relief medicine, which is an inhaler, or a long-term relief medicine, which is singular or pills. There are many types of asthma drug therapy. They have the relievers, controllers, preventers, and combinations. All of these are very useful for asthmatic patients. Weather plays an important role for aerobic and anaerobic exercises when it comes to an asthmatic patient. It is harsh for an asthmatic patient if it's very cold, hot, and dry environments. Conditioning is important for these climates so that they would lower the risk of having an asthma attack. Exercise-induced asthma is very common. It is very common in people with and without asthma. It occurs when anaerobic and aerobic exercise performance is being done. It causes asthma symptoms, and it can also be controlled by medication and proper conditioning. A large portion of my paper was research based off of children with asthma and aerobic and anaerobic exercises. It is common with children with asthma to be overweight. Sometimes they do not think they can perform an exercise activities because they have asthma. This can be very discouraging for children who have asthma. The more exercise that they do, the less likely they will have asthma as an adult. They are still able to perform in sports, they just may have to experiment the ones that fit them the best. In conclusion, the literature review is based on the effects of asthma on aerobic and anaerobic exercise performance. All the articles that were found gave relevant information to back up my thoughts and theories on this. Although some more than others, I did find some interesting facts. Most of the population that is affected by asthma and exercise is children and young adults. This is mainly because of their lack of activity levels or how they prepare themselves for the activity. Since asthma is a chronic respiratory condition that narrows the airways, it causes symptoms such as wheezing, shortness of breath, and coughing. There are several treatments such as medication, but most importantly, exercise. Exercise is the key to a healthy lifestyle that many people struggle with. The effects of asthma has on aerobic exercise is that people who are not used to a regular aerobic exercise will lose their breath faster and have an asthma attack. Therefore, it is important for people with asthma to do aerobic exercises such as training and conditioning, giving them the opportunity to perform exercise efficiently. Asthmatic people who lack aerobic exercise will have a negative effect such as diabetes, high blood pressure, weight gain, and depression. Aerobic exercises consist of running, jumping, and low to high interval training. The reason why it affects asthma patients is because their airway passage fill up with fluids such as mucus and their chest tightens up. The more active someone is, the higher their intensity rate will be. There was not much research done on anaerobic exercise performance, but the conclusion that I got out of the research is that it has some of the same effects that aerobic exercises have. Anaerobic exercise performances are when the intensities are very high for a short amount of time. For example, track sprinters. These athletes usually have asthma problems when the weather changes or is a harsh climate. Exercise-induced asthma is what the technical term for asthma is that is affected by exercise. It is very common for non-asthmatic patients as well as asthmatic patients. The best way to treat it is to do more exercise and use the proper medication the doctor prescribes.